Well, I came across the most recent HIV/AIDS estimates revealed by the National Agency for the Control of AIDS, showing that 3.1 million Nigerians are currently living with AIDS, and a greater percentage of people that are infected are dying from the disease. It's obviously a problem that is rife on that end. What's standing in the way of effective treatment?
Well, just like you've said, I think you made a very good point there. We have like 3.1 million people living with HIV/AIDS. But one of the things that I think it's important to stress here is that the prevalence of HIV has actually reduced from 4.6 to 4.1. But if you look at that 3.1 million people, Nigeria is one of the countries that's really at pace in trying to implement the new WHO guidelines. And that's really where the problem is, because whereas our old guidelines, we had like 800,000 people to treat, and we had gone like halfway, we actually now treat like 415,000. Now we have to move to the new guidelines, which is dictated by the science, that if you treat early, people live longer and they live better. So if you look at that 3.1, we have like 1.5 million people to treat. Mm-hmm. And that's where the gap is. And we're not relenting on this, because the issue now is that we have to step up to see how we can put more people on treatment. We're working with all our partners, trying to develop a plan as to how we can get as many more people on treatment as possible, as fast as possible.
Let's look at the strides that are being made then, because when it comes down to it, looking at things on paper, there seems to be quite a bit of work that's been done. We've got the National HIV and AIDS Policy for 2010 to 2015, HIV/AIDS National Strategic Framework for Action. We've got the National HIV Prevention Plan as well. So it seems that there's a lot of, the goal and the agenda on paper, and it's actually translating that's the problem.
Yes, I quite agree with you. I mean, it's one of our best plans, really. And as you can see, it's a costed plan, different from what we used to do. And that actually makes it better for us to resource the plan. But currently, we're now trying to operationalize the plans. And different from what we did before, Nigeria has 36 states and an FCT. Each of those has, a strategic plan, talking or derived, which actually culminated in the national plan. And each of them now are at the point of trying to derive, a 2-year plan from, the strategic plan. And we are extremely hopeful that we will resource it, because many things are coming our way at this time. As opposed to what happened before, we're moving, our services from urban areas to the rural areas. And that's important, because when you look at, the HIV surveillance that, just spoke to, we find, for example, that many of the issues that we have, many of the states where our prevalences have not either gone down or gone up, were places where the rural HIV prevention had exceeded, the urban prevalence. So moving services, comprehensive services from the urban areas to the communities through primary healthcare settings, and ensuring that we integrate it, we believe that has a multiplier effect in actually addressing, prevention, treatment, care, and support.
We were chatting to a guest from Netcare a little earlier, and she highlighted that in sub-Saharan Africa, it's these smaller economies with a smaller fiscus that actually face significant challenges, because you face budget constraints in actually getting things off the ground. To what extent is that a challenge posed for the problem in Nigeria, where per capita expenditure on health is not nearly where it should be?
You're right about that, and we're very conscious about that. And we actually want to own and sustain this program if we're going to make any significant impact. As a result of that, there's a lot of discussion in country between, the government and partners, and particularly the private sector. Nigeria is one of the countries that has not looked at the private sector. There's a huge window of opportunity there, and I think we really need to capitalize on it. So we're looking at the private sector to see how we can resource, our program. We're also trying to talk to government so that we can draw near the Abuja declaration, which states that 15% of the budget should go to health. And we believe that if 15% goes to health, a significant amount will also go to, HIV and related response. It's also important to recognize that partners have come in and they're driving the response with us to ensure that in country. We can talk to high government officials. We can talk to the various assemblies at national and state level to see how. And communities cannot be left out, because when you look at resources, you're talking about funds, you're talking about goods, you're talking about services, and you're talking about human capital. And we believe that moving down the way we are moving, it's a movement. Movement from the urban to the rural areas, that we will be able to, ensure that we get a lot of these resources to be able to address, the HIV issue. Critically, we must reduce, new infections, because that's the only way, we can move the HIV epidemic. Nigeria is stable, it's halted the HIV epidemic, but we need to reverse it.
Of course, fighting disease epidemics like AIDS ranks high on the agenda of Millennium Development Goals that need to be targeted as well. And purely because of the kind of economic impact this has on a country. Let's take a look at things, and it may sound a bit clinical, but at what cost this epidemic is coming to the country in terms of production and economic growth.
Well, I think you're right about that. That's one of the areas where I believe that we're not doing as well as we should be doing. It's not enough for me to tell the government, or anyone to tell the government, that HIV has, the prevalence has dropped from 4.6% to 4.1%. We need to provide those evidences to our politicians and people in high government offices, the kind of evidence that can change the tide, that can motivate them to put more money. If you look at my country, yes, we're rich, but we're poor, but we're rich. Those kind of evidences that we need to show them that will avert new infections, the evidences that I believe we need to provide to say, if we put X number on treatment, families, we revive families, we revive communities, and we revive the economy. We are not seeing that type of evidence. And in Nigeria, one of the things we're trying to do now is put ourselves together and see how we can get those kind of evidences that can motivate a political capital and political commitment. And I think that's what we all need to be doing in sub-Saharan Africa, so that at the end of the day, we rely less on donors and we can own and sustain these various programs.